I think one of the controversies right now is, in my mind, the lesson of PointBreak was that the regimens of carbopaclitaxel Bev is equivalent to carbopemetrexed Bev, differing toxicities, but in that trial they had different maintenance strategies. Either continuing bevacizumab alone on the paclitaxel arm or a 2-drug maintenance strategy on the pemetrexed arm. At the end of the day, the overall survival was identical on both arms. And
although they did do a landmark analysis that suggested perhaps a 2-month advantage for the combo.
Yeah, the key words are suggested perhaps.
There was, as I recall, there were no p-values or hazard ratios as part of that analysis.
Right.
And yet in AVAPERL, we did see a statistically significant PFS advantage. If you want to describe that trial.
AVAPERL and PointBreak are different. PointBreak patients were randomized prior to the start of treatment. And so you don't know when you're starting how many patients are going to get through 4 cycles and what kind of shape they're going to be in and what you're going to do after 4 cycles. AVAPERL didn't look at the first 4 cycles. It really randomized those patients that had stable or responding disease at the time of the 4th cycle to either continue Bev alone or Bev plus pemetrexed as maintenance therapy. So all of those patients that didn't make it through 4 cycles or had disease progression drop off. And so you're looking, those are very different.
And the induction regimen was cisplatin PEM.
Cisplatin PEM Bev, yeah. So, I don't know, I think that, personally I find them hard studies to compare directly the results of because of where patients were randomized.
Although if you look at the landmark, from the point that they actually went on to the maintenance phase, both trials have suggested...
There are similar suggestions.
So we have one trial that hopefully will settle this issue, ECOG 5508. Ross or Mark, your comments on this?
5508 is, I think it looms large as an important trial at this point. And that is a trial design where we use the 4599 regimen, carboplatin, paclitaxel, and Bev for 4 cycles. See, even your cooperative group uses 4 cycles.
Although they originally used 6 in the
So after 4 cycles,
trial.
these patients with stable or responding disease are randomized to the control arm, which is continuation maintenance with Bev, in 2 investigational arms. One is switch maintenance to PEM, or an arm that is continuation maintenance with Bev plus switch maintenance
a hybrid.
with PEM. A hybrid, yeah. And so I think in the endpoint of that trial is overall survival.
I believe it's PFS, actually.
Is it PFS? Okay.
Certainly overall survival is a secondary endpoint.
Right.
It's a big trial.
It's 1,500 patients or so. So I think that design is a great question. I think the results of that trial will be very helpful to day-to-day practice.
It'll definitely be one of the largest trials in the maintenance setting.
Yes.
I suppose purists might argue it still doesn't have a control arm, that we don't have an observation control with perhaps a PEM-Bev combo at the time of progression, but I think that train has passed the station.
Well, yeah, I mean, one of the continuing questions with Bev is, how much benefit do you get with it purely as a maintenance drug? And we don't have a trial that really addresses
We've
that.
never isolated it in this setting.
Right.
Speaking of bevacizumab, we're at 2014 ASCO, the Ravel trial is going to be unveiled, and that is a trial that looks at ramucirumab, again, an angiogenesis inhibitor, in the second-line setting, so all comers regardless of histology. It's not confined to non-squamous. Docetaxel, either alone or combined with ramucirumab. I don't think we've seen the full data yet, but we've been told that this is a positive effort, that there is in fact an overall survival advantage. Ross, your comments on this? Are we witnessing a resurgence of angiogenesis inhibition in non-small cell after a relatively dormant period with major disappointment of all the TKIs?
Well, only time will tell, but so ramucirumab is different from bevacizumab, so it's directed against the VEGFR2, against the receptor, as opposed to the ligand that bevacizumab is directed against. It's already got a license in gastric cancer. I think it's either shown promising results or may even got a license in ovarian cancer. So it's an interesting drug. Here they went for a second-line study, aggressively allowing all histology, so obviously what's going on in the squamous patients, I don't know how many will be in the study, will be interesting to look at. The question that everyone's going to ask, though, is how big is the benefit? How much does the drug cost? And they may even ask, is it any different from if I'd used bevacizumab in the same setting? So those are all questions that will
Which have
undoubtedly
never really
arise.
been formally
Yeah.
looked at. And certainly in this era of cost containment, that may be a major issue, depending on the degree or the magnitude of benefit that's seen.